Good afternoon, ladies and gentlemen. It is a privilege for me to be here today. Of all the conferences I've seen this year, this is by far the most interesting I've seen. Most interesting speakers. Seriously. Thank you, Robin. Also, an incredible organization, so thank you very much for the guys who are organizing. I don't know if any of you have had the time to actually read the program, but it was quite interesting. If you read the first phrase of the program, which was written by Antoine Zinn, it says, "Barbarians are knocking at the gates of medicine," which is true. Barbarians are arriving. And it goes on to say, "These disruptive innovations are creating a new healthcare, more efficient, transparent, and connected." This is great. Barbarians are arriving. They're changing everything. But on the other hand, barbarians also mean that we have everybody doing anything they want. And this is unfortunately, at the moment, in the definition of the word connected health, creating a bubble. It's creating an artificial bubble because it's become too easy to make new products. Any moron with a good idea goes and puts it on Kickstarter. 2 days later, he has a working prototype and he launches it, which means that people are not focusing enough on connected health. They are focusing on a thing called connected wellness. And connected health is about management of chronic diseases. And when you have a chronic disease, you are defined by your lifestyle. So we need to look at where connected health is going. Are we going to go into an environment of connected wellness or connected health? Now, to look into the future of connected health, we need to look at the past to see how it's happened. Now, a simple, very simple short history of connected health is this. In the beginning, there was nothing. And Jobs said, "Let there be light." And the world saw that the light was good. In 2008, when the iPhone 3 appeared, it changed everything. Because suddenly, all of us saw a new way to communicate with patients, to increase the communication rates between patients and doctors. So all of us, we precipitated ourselves on a new phenomenon called connected health. With that, all the magic words came out: quantified self, e-health, m-health, sustainable health. And I'm the first culprit. We're the first ones to say, we want to do this. We want to do connected gadgets. So we created a new company called iHealth. So we thought we're going to make cool devices that are connected to an iPhone, doing blood pressure, weight, diabetes, exercise, sports, COPD. And we'd connect them all to a single platform, to a single app. I'm telling you this because this is bad. So we designed an award-winning app. Today, with 2.8 million patients using it, available on Android and on iOS because everything is wireless. And we thought that was pretty cool. And we also thought, let's have an open API. The fact that having an open API means that we are compatible with any third application out there. Anybody who wants to connect to an iHealth device, takes 2-3 days to do an integration. It's relatively simple. It's allowed us to do big programs like the Health e-Heart study, which is the world's largest epidemiological study on heart disease, done with the Heart Foundation, where every day we have 1.1 million people sending their blood pressure to the Heart Foundation. Now, I don't want to get today into the debate of data safety, because right now I just want to stop any questions about data safety, because it's a fake problem, the problem of data safety. We're all talking about it, but in fact, the fact is that in 3 years, everything will be connected. And when everything becomes connected, people stop worrying about safety. So we, of course, also were the first device that was compatible with the Apple Store, which sounds little, but in fact, the arrival of Google, of Apple into the healthcare industry does only one thing that is great, and it democratizes healthcare. More people are listening to music today because of iTunes, because of the iPod. And the fact that we have a health application available on every single phone in the world is a great thing. It's not a negative thing. All right, so we have a great concept. Gold in our hand, gold under our feet. The people love it, the media love it, the growth, investors, everybody says our company is great. But I'm not happy. The market says that we're great. I'm listed on the Shenzhen Stock Exchange. Today we're worth, that's my share price since December last year. Suddenly the world is waking up to the fact that connected health is there, especially in developing countries. We're listed on the Shenzhen Stock Exchange, and China 100% developing country is really waking up to connected health. Share prices tripled in the last year. We're now worth 10.3 billion, but actually I lie. It's not 10.3 because I just checked this morning, we've gone up to 11.2, which is quite cool as well. So all of this is very nice. We have a beautiful dream. We want to make fantastic products. We want to be successful, but it's just not enough. My dream, of course, is to make a world where devices where we go beyond the 1948 definition of what health is by the World Health Organization. The WHO said in 1948 that health is much more than just the absence of disease. We want it to be health. It's about taking care not only of the body, but of the mind, of the psyche of people, of how people are thinking about their health care. A dream where people actually know what to do automatically. You know, in 1978, when the French government announced that you had to put safety belts into your cars, France was the only country in the world where there were strikes. How dare you tell me what to do in my car? But today, you put on your safety belt, you go into your car and you put on your safety belt. It's an automatism. You do it without even thinking. We need to have the same approach to healthcare, where it becomes automatic for people to take care of their health. It's simple, it's evident, it's natural. You shouldn't actually have to think actively about taking care of the healthcare program. And again, this is where the big companies, Google, Microsoft, Apple, are coming in, are really changing the data. So, of course, personally, I would like to build a company where iHealth is a real link between people, not just about their medical data, but about the way they live. And a dream where people use our products and we make more and more affordable healthcare. Yes, I know, I'm very sorry, I should not have used that. It is a dirty word in our industry. Affordable. Affordable is a huge problem. We're moving now in a world where devices are becoming so expensive that the only people who buy them are people who don't need them. We're making devices that are linked to specific systems for rich people. Everybody in this room here has a smartphone. Or am I wrong? Does anybody here not have a smartphone? Well, the problem is that you are non-representative of what the real world is out there. Dreams are very fragile. Right now we're heading towards that bubble where people are thinking, ooh, how long is it going to last? Am I going to continue investing in connected wellness? We need to be very careful. The real future of health is not me making devices. It is me, it is you, it is the insurance companies, it is the governments. It is where everybody becomes involved in healthcare. It is a virtuous circle. We cannot do it alone. So as I said earlier, this is not iHealth. This is just plastic. It has zero intrinsic value. It's just junk that we sell through various B2C networks. It's sold via the cousin of the friend of the dog of Harry on the Apple Store, or at the Darty of Fnac or Boulanger, which means that people pay €100 for a device. That's crazy. This here is iHealth. It's the 2.8 million people that we have on the cloud that every day are sending us their data, that is allowing us to do epidemiological analysis, that is really allowing us to see the difference between different people out there. We've employed the world's best people, engineers, but also amongst this audience, we have people from all walks of life, but we're all working against one another. We're all busy having our own protocols for our apps. We do not want to share the information. This is a terrible mistake. We need to really listen to what people are looking for. We need to see what the world is asking for. We need to watch. We need to be aware of what the other people are doing. We need to, I know it's a silly word, it's a Walt Disney word, but we need to feel. Not just what we're feeling here, who cares? We're rich, we have smartphones. We need to feel what Mr. Shipwash Makanka Bodwe, who's living in a village in Africa, that's what we need to feel. And mostly what we need to do is we need to understand. We need to understand what the end user wants and give him the only thing that he really needs. And there's only one word, and that's a relationship. Whether you call it a useful, fascinating, indispensable, whatever, what the end user, the patient is looking for is a relationship. And right now, we're not doing that. We're pretending to do it. Over the years, I've been making medical devices for the last 20 years. Clinically validated, ESH, BHS, whatever devices. And over the last 20 years, I've developed a firm set of principles on how to develop devices, together with somebody I'd like you all to meet. Is Mathieu here? Mathieu Rogeau? So Mathieu Rogeau, ladies and gentlemen, who's one of the hidden gems of healthcare. He's the man behind the design of all the healthcare, most of the healthcare devices available today, an outstanding designer who allows me to think out of the box. The problem is if you ask me to design a blood pressure monitor, it will look like a blood pressure monitor. Because I've made 220 blood pressure monitors in my life, so I know that that's how you make a blood pressure monitor. So I have an industrial baggage that stops me from thinking laterally, which is why I'm so happy to be working with people like Mathieu, whose official title in the iHealth organization is Artiste en Résidence. And we really need to develop people, to push people. So over the years, I've developed 7 different principles, which I call the Bible of product development. 1, product excellency. We need to have superlative products. Lifetime warranty, 0%, the quest for zero defect. That's what we must have. We need to have service quality. Today, if somebody has a problem, he'll talk about it on the internet. If he doesn't have a problem, he doesn't say anything. But there's nothing worse than a disgruntled client. We need to provide perfect service. We need to have integration to all other systems out there. We need to have completely open platforms so that whatever my device does can complement what another device does. We need innovation. We need really more innovation. We need more research, not continuously making the same thing over and over. At CES last year, there were 60 manufacturers of trackers. They all do the same thing. They all have beautiful designs. They're fantastic and beautiful, but they all just take your steps. Let's move beyond that and propose real innovation, fundamental innovation. We need something that is sorely lacking today, clinical and legal validation. And that's why when Antoine writes, barbarians are knocking at the gates of medicine, it's great. But we must not forget that one fundamental thing. We need clinical, legal validations on our things. We need medical acknowledgements. Doctors are scared of connected health. They think, connected health is going to replace them. No, not at all. Connected health is there as an absolutely essential adjunct to better healthcare. It transforms the patient into an actor of his own health. And lastly, and more importantly, we need affordability. Now, this is a picture I took in the underground cistern of the town of Istanbul. It's the water system. Now, you have these beautiful pillars that support the structure. If I remove one of the pillars, it's great, it'll still hold up. But you remove more than 1 or 2, and then suddenly the entire thing falls down. I'm not saying that it's essential to have all 7 of them when you launch a product, but you should aim to at least have 5 out of 7. You cannot just only have a company that's based on innovation. You need some of the other issues as well. So, as I said, now I'm going to tell you all the problems that we're facing today. Sorry, I'm not a very negative person, but I just have to talk to you about some of the problems. So we have affordable healthcare. In the last 20 years, I've done 250 pilot programs for telemedicine. Pilots. We never go beyond the pilot. A pilot typically says that we take $450,000 from the IRS de Bourgogne to show that 50 patients who are well managed will cost less than 50 patients who are unmanaged. We know that, yet we still continue doing pilots for 2 reasons. One is that the financial aspect. It's okay to use $450,000 for 50 patients, but if you want to move to cohorts of 80,000, 200,000, 300,000 people, you cannot have devices that cost $30 a pop. It's just physically impossible. Secondly, the other reason why pilot programs have not functioned is because if you have a chronic disease, you are defined by your lifestyle. So if I bring you a solution to manage your health, to manage your diabetes, your multiple sclerosis, whatever disease it is, that solution must simplify your life. If it makes it more complicated, you'll use it for 2-3 days, and then you'll think, gosh, so this, and you do something else. Previously, the telemedicine programs, you had to take the RS-232 cable of the device and plug it behind the computer if you had the right adapter. Then you had to take the data and send it to the doctor. And honestly, chronic disease, you are defined by your lifestyle. So we need to make more affordable and easier to use devices. This is beautiful. but it is a problem. As I said earlier, today, only 55% of French population has a smartphone. Okay? So we cannot have programs that we want to disseminate in the whole world for only 55% of the population. And Mrs. Michu, who's working as a cashier at a Monoprix in Issoudun, she does not have access to this. She's not the person who can actually touch a smartphone or even understand. My friend Lionel Rijkaard, that all of you know from the name Pharma Geek, he told me the other day, in the next 5 years, of all the telephones that will ever be produced, even if they are smartphones, 25% of them will never go on the internet. That's amazing. So this is a problem. It's too expensive. Here's another problem. Today, there are 1.2 million apps on the App Store. There's 1.1 million apps on the Android store. There's more and more apps. How do people choose? How do you get somebody, I mean, there's this huge business that's busy building, I want to make the definitive app that's going to change everything. But it's very difficult. Today, 1.6% of all apps represent 98% of all turnover of apps. An average app developer earns less than $100 a month. So there's no yet any serious business model scenario for app writing. All right, so another problem, Android. I love iPhone, all right? I've been with Apple for the last 20 years. I think Apple phones are easier to use. Of course, but we have Android. And everybody thinks, oh, Android's coming, it's going to make things much easier. Today, there's 599 Android manufacturers of phones. There's 3,997 different Android phones out there, which means that if you write an app for Android, you need to actually make it compatible with 3,997 phones. It is virtually impossible, but they're really cheap. So I assume that everybody is going to be buying Android phones. Is that the case? I don't think so. Well, the average phone in developing countries looks like this. You'll be lucky if you have an HTML browser and indirect manipulation. And these are the people who need connected health the most. These are not people like you and me who are living in cushy homes with smartphones. This is the healthcare of tomorrow. But we need to provide for this. We have a new problem. This has very recently appeared. It's a new concept. It's called China Collaborative Design. It's fantastic. The other word for China Collaborative Design is copy. All right? The fact that I want to show you a phone that I've discovered in China about 3 weeks ago. This is a real existing phone that's out there on the market. Meet the ever so desirable Voda Podberry. This is available. You can buy this in China. Fake BlackBerry logo, fake iOS operating system, and a fake Vodafone logo. This is 100% fake, but it's for sale. I was in Italy 2 weeks ago speaking to Riccardo from Vodafone. I showed him this. He just about fell off his chair. But this is what is happening in China. There's thousands of phones that are appearing, and there's no ways any of our apps will ever be compatible with this. But this is what people are buying. So how do we resolve these 4 issues? We have 1, the problem of affordability. 2, the problem of non-use of smartphones by elderly. As I said, even if they have a smartphone, they'll just use it to phone. We have too many apps and too many operating systems. So as I said, I'm very proud of iHealth, but at the same time, I'm very disappointed of the fact that we're not moving faster towards a better solution, a more intuitive solution. So I'm about to launch a new product, a new range of products, which I call iHealth Discovery. All right? The principle of iHealth Discovery works on one incredible platform. And we all know this platform, and it is the cloud. The cloud is a magical thing. Ronnie's made it perfectly clear this morning. Patients want to share their data. There's nothing like a chronic patient to say, please take my data if it can actually make the world a better place. Now we're all busy shaking the ghost of data safety. But ask the people who actually really need to share the data and who want to talk to other patients and want to share the data to make the world a better place. The cloud is here to stay. It will always be there, and within 2-3 years, everything will be connected. So let's stop worrying so much about things that we cannot do and do things that we can do. Most people right now in this industry are only doing things because they have to. We really should be doing things because we could. And that would make a huge difference, that we can push a little bit further and find a way to use the cloud, find a way to use the data of thousands of people to make people's lives better. So what we've created together, Matthew, myself, and my brilliant Parisian team, is a new platform, what I call iHealth Discovery. So the idea is I need to desist myself from the use of smartphones. Smartphones are an incredible break to the use of connected health because there's too many models, they're all too different, and they're too expensive. So we've made this wonderful new platform, which is basically a data aggregator. So you put it next to your bed, you're a little old lady, and it's great, you have a thing. And what if I told you that over and above that, it also can do luminotherapy and wake you up in the morning with the sound of birds and the correct light. But what if I also told you that it could change color when it's time for you to take your medication? And it could remind you when it's time to do things. And then what we've done is created a new set of tools on a principle which I call simple as 1, 2, 3. So that's a blood pressure module. The little old lady, she's home. She wants to take her blood pressure. 1, 2, 3. 1, you put the cuff. 2, you press start. And 3, you see the result, which is displayed in color-coded format, green for normal, yellow for dangerous, red for even more dangerous. And the data is continuously streamed without her having to do anything to the data aggregator, which then sends it to the cloud. And then we've created an entire new set of tools around that. Everything from diabetes to this. These are the first 6 modules. I say 6, even though there's only 5 pictures, because that middle module there, that little watch, also acts as a fall detector or as a geolocalization, and it gives you the time as well, which is pretty cool. And then we have the camera, the glucose monitor, and the scales. And these are just the first set of devices. And we, of course, also have, I don't want to disturb the sound, wireless ECG, 24-hour ECG patch that you can just stick on the old patient and we'll send it all automatically to the cloud. Now, the question is, what do we do with the data? All right, so the data all gets sent to the magic word, the cloud. Cloud is an incredible tool. It's just a bit, right now, nobody's really using the cloud. Right now, we're just logging the data and counting the data. What use is that? The real use of the cloud is going to be when all the data gets put together and we can actually start integrating socioeconomic data about the consumption of meat, the consumption of fuel, and the weather, and all of these platforms, so that very simply, every day, through an evolutionary statistical algorithm, the little old lady, she can get a message on her phone by SMS. By SMS means no smartphone. All phones are compatible. Hi, Mrs. Smith. We've noticed that for the last 3 days, your glucose levels have been going up. Would you like us to send you a reminder when it's time for you to take your glucose? Or your blood pressure is perfectly stable. Messages of encouragement. So this is really not a platform for disease management. It's a platform for patient management. Because if you look at the 4 biggest spends of any medical aid worldwide, medical aid, government, insurance companies, the spends are always the same. Number 1, diabetes. Number 2, cardiovascular disease. Number 3 is cancer. Number 4 is overweight, which is not a disease, but which engenders other diseases. Now, cancer, I cannot do anything about yet. But the other 3, diabetes, blood pressure, weight, all of that walks hand in hand. And these are all diseases or pathologies that are better managed by the patient himself than by the doctor. So the future of healthcare, as I said, is really not us working together to make new products so we can sell new products to end users. It is to make a collaborative platform between the patient, the insurance companies. Everybody's scared of insurance companies. We all know that insurance are all out there to screw us out of our money. Taking an insurance is not a positive purchase. You know that you only take an insurance because you have to, not because you want to. What if you took an insurance because you wanted to? What if it actually offered you such a great service that you thought, this is my indispensable partner for better healthcare? That includes the pharmaceutical industry, it includes the insurance companies, the Mutuelle Générale, or whatever companies they are, so that we all work together towards a better patient management. So, in the original question of the battle against chronic disease, When is enough enough? The answer is quite clear. Never. Nothing will ever be enough in the battle against chronic disease. I'm tempted to paraphrase Winston Churchill, 1942, while addressing the House of Commons in the UK. We shall go on to the end, whatever their cost may be. We shall fight them on the beaches, we shall fight them on the landing grounds, we shall fight them in the hills, we shall fight them in the streets, but we shall, iHealth shall, never give up. Thank you very much.